So you hear about implants. That's what we do here a lot, are implants, and we enjoy doing them very much because through implants you get to get your teeth back, and it's a very simple process to be able to get these teeth back, and it's a very good permanent process. Implants are basically titanium screws that go into your bone. It's the best way I can explain it. That's very simple. During the procedure, you don't feel anything. It's very simple. We do a little pilot hole, make a little hole in your bone and screw that into your bone. It sounds terrible, but I promise you will not feel anything, and it's very comfortable. After an implant is placed inside your jaw, it needs to heal. And depending on where it is in your jaw, it can take about 4 to 6 months to heal. What's actually happening to that implant, which is the interesting part, is your body is growing onto that implant. That implant is becoming part of you. I normally kind of tell people it's like putting a screw into a piece of wood. If that screw is sticking out, which your implant will a little bit when you have a crown placed on it, and you start wiggling that screw a lot in that piece of wood, it's eventually going to come out, which is why we place those implants and leave them in there to heal for a long time, because once you get a crown on there, you're going to be chewing on it, using it. We don't want that thing to wiggle out. So while that whole time while it's healing, it's becoming a part of you so it doesn't wiggle out. After it's been done healing, most of the time we go in and we put a little, what we call a healing abutment or a healing cap on top of that implant. And that will stick out maybe about a couple millimeters or two, about the size of the end of your fingernail. And that will stick out there for about 2 weeks. Your dentist will use that healing abutment or healing cap to be able to make that crown and place the crown on top of your implant. Then you'll have a brand new tooth.